Hey guys, this is James,
And Sean.
and we're here to kind of like jump in and start looking at this measure of the month. And we thought it'd be kind of fun to make a little bit video, nice little video, kind of looking at how you find that in CRS and find it your GPRA measures and that logic, and then how to resolve it. That's the big thing. We have a lot of sites going out doing a tobacco exam, annotating the screen saying the patient's a smoker or non-smoker. But what we don't have is counseling being done, the education being done for those individuals who are smokers. So first what we're going to do is look at the CRS, how to go in and look at this to kind of find out if the educations are hitting or not that you guys are performing. So what we're going to do is going to go up hat CRS for your clinical reporting system. We're going to go into number 7, the latest logic. So that's 2013. We're going to run a report, RPT. We're going to run a local report. We just want to know our stuff, what's going on. We're going to do community, COM, and we'll do selected measures, SEL. In here, now you start looking at all these, look at all these cool things we can kind of look at in here if we wanted to find out where we are at a location. So what we're going to do is we're going to enter down until we get to number 24, tobacco cessation. So S for select, 24. Q for quit. You see the little asterisk up next to it. I'm going to go ahead and enter through this, and I'm going to pick my GPRA year. So this is as of now to date how we're doing. So number 3, 2013. That's the GPRA year. I'm going to enter through here. I don't need all the dates and all that good stuff. And then I'm going to do 2011. So this is going to run it against a year. So we're going to look at like how you were the previous year and the year before that. See if you're making progress. Enter the community. This is automatically the last one that we did. You would have your own taxonomy of community in here. And then same thing with facilities. And I don't need a patient list, but if you would like to get fancy here, you could go ahead and select yes, and it'll actually give you a list of all the patients and who's had the exam and who hasn't had the exam, which is pretty handy, you can imagine. We're going to pick our active beneficiary population here. And then I'm just going to print a screen, so I'm going to enter through. Now, while that's going, we'll kind of dig into how to resolve this. So in our electronic health record, we just went in and picked a demo patient and created a visit. And we're now over here into the 3 different ways to do this. Now, Sean was pointing out earlier that this doesn't have to be done by a provider.
No, this should accomplishing our GPRA measures and our monthly measures can happen with help from the case management support with the providers. It can be with our behavioral health, and it can also be with our dental. So we want to make sure and have as many people trying to capture these measures as possible so that we can knock it out of the park.
Yeah, and this is really where those concepts of integrated care happen. Before we're focusing at, we're kind of like these siloed places, and we keep asking the patient the same question, kind of making them jump through the hoop. But in patient-centered care, we kind of are all aware of this, and we have one person do it, knock it out, and everyone can see that it's been done, and we aren't repeating ourselves over and over again, making the poor patient jump through these hoops. So good point. So what we're going to look at is 3 places. We're going to look at the clinical reminder, if you have that, patient education and exams, which where we're in right now, and then the super bill. These are all 3 places where you guys can annotate the tobacco education. So first up is the exams. You can come up here and you can actually add the exam in here, saying that you actually looked at the patient and you assess them for tobacco use. You could also go over here to the education tab. Now remember, this is tobacco cessation. We're looking at patients who are smokers and seeing if they've had an education, tobacco quit education. So if you go over to education, add, you can come down here and you can see tobacco use. In here, you can look at all the different types of, wow, there's a lot of educations you can do. Let's look at disease process. If you have any questions about this, you can quickly come over here to outcome and go ahead and read all of that, and that's what you should be talking to the patient about. You could also Control-C or copy this and paste it into your note if you'd like. You could even print it out and give it to the patient. So if I was to select that, I could select that right here. It would basically give me patient's understanding, individual. You can do group, length. You could say you talk to them for 3 minutes. You can make a comment. Fancy thing down here, readiness to learn. This is kind of becoming a new thing. Not ready, eager to learn. Goal set. We're actually starting to look at these now. Are you setting goals? Hey, try smoking 1 cigarette less a day, etc. But what I'm going to do is go ahead and instead of hitting this and having it stuff, I'm going to go ahead and cancel out of here because I want to keep this blank so I can show you how the reminders function. So that's where you do it in education. Next, we're going to come over to Superbill. Now, a lot of the new EHRs coming out and the pick list that you'll see will actually have this in here. You can go ahead and add these, and if you need, you can contact us and we'll show you how to put this in your electronic health record. But this is pretty slick. If you go to the Superbill portion, actually there's a tobacco cessation, and people put in 2 codes, 99406 and then 99407. And that's basically a tobacco cessation counseling 3 to 10 minutes or greater than 10 minutes. So if you, again, select this, it will satisfy that for tobacco users. But finally, and this is the one-stop shopping where everyone's got to go, whether you're a CHAP or you're MD or you're a case manager, it's the notes. And that's where the clinical reminders come in. So I put two versions. I put the 2011 and 2009 reminder in here, and we'll take a look at both of those. So we just created a note chart review, and I'm going to go ahead and pop this up. And here's one of them right here. You can do the tobacco use assessment. Is the patient a tobacco user, maybe ceremonial use only? And then you can go ahead and give them, Sean was mentioning earlier, here's the prevention education. And then understanding level good. Let's spoke to the patient for 2 minutes. Readiness to learn, eager, and then you could type in here ceremonial use. Now I can just go next, and it'll actually take me to the very next one. And tobacco screening should be done yearly. Let's say tobacco use screen. Patient reports history of tobacco use. Current history, we'll go ahead, click that. Patient is a current smoker, we'll say that. And then we can make a comment. Patient has stopped smoking. But if you look down here in those older reminders, this is where I think there was a problem. It was kind of hidden. Tobacco cessation education is just this little tiny dot down here, which opens up a whole bunch of more stuff. Well, here's the one that you wanted to hit. Patient does not wish to quit using tobacco at this time. Patient desires or is enrolled in a smoking cessation program. So unless you went down to the bottom of this reminder and clicked that, you wouldn't be necessarily getting that result that you want. Again, good, comment if you want. You go finished. And what we're going to see now, if we go back to the exams portion, you're going to see that stuff actually starting to populate in here. So there is the tobacco use prevention, and then there's the use and complications that we just did. And I even typed in a little junk in there. So that's what we mean by stuffing when you look in there. So that was all performed from the reminder, but yet it's actually stuffing stuff into other aspects or in other areas into electronic health record. And this is where GPRA pulls that information out. So now we'll go back and look at those numbers. And here's what it looks like in CRS when the report runs. You just kind of enter through. It gives you kind of like some demo logic. But then after you get down here, you start getting into your actual logic. And we like to look for the bracket that says GPRA or GPRA MA. And that's kind of our identifier. So we just keep kind of entering until we come across it. And there you have it. GPRA, active clinical tobacco users, 320. For us here at APIA, we have 69 who have, we've identified 320 smokers, but we've only counseled 69 of them for tobacco cessation counseling and educations. So I think we need to get to 36% or something like that. We're at 21%. So we got our work cut out for us. If you want, we can make a video showing you guys how to find out who is due, and then you guys can give them a call or case manage and get those educations done. And that's pretty much it. That's all I got.
And that's all we have.
All right. Awesome, guys. Do well.